Mary, can you hear us?
Recording in progress.
There we go.
Yes, I can now.
Okay, great. Okay, welcome everyone to the April 7th, 2025 meeting of the Yarmouth Board of Health. Just one item to mention for kickoff here, it's a hybrid meeting, which we've been doing this since COVID. That essentially means people can come to the town hall or they can connect with us listening or actually participating by calling and speaking up. We have a number of ways to get on. There's a phone number, and I can read it right now, and that's 253-215-8782 or 1-312-626-6799, and you would enter the ID number, which is 871-1526-3955. If you wanted to speak, just press number 9. It's a lot. This will be on the website if you go there, and certainly the connection to Zoom in is on the website as well. To start with, we'll go with some attendance as usual. Gentleman to my left, are you here, Eric?
Present.
Hillard, I'm here. Larry?
Here.
Okay, so Charlie, I know, is not attending tonight. So, Eric, it's okay with me if, or you rather, to call to order the meeting? What, yeah?
Absolutely.
Go for it. Okay, there we go. And
I'm here.
And
I'm sorry about it, Mary. Okay.
That's all right.
We just need a declaration of quorum. We have a new list. This was written up a little differently, which,
Well done.
yeah.
very.
So we're just working our way.
Easy to read.
Yeah.
It's very official looking.
Yeah, makes us feel something. I don't know, but it's new for all of us. Okay, so next up was the declaration of quorum, right? Since we have 4 people here, I would declare we have a quorum. Would you agree tonight?
I agree.
You definitely would. Okay, so public comment as usual. So anyone has the opportunity to come forward, make a comment, ask questions, and anyone could be at home calling in via Zoom or right here in Town Hall, if anyone would like to come forward.
I don't see any hands.
No hands. Okay. Let's start. We're on number 4. It's Englewood Condos /60 Broadway, and the topic tonight is pool rules and regulations. Barry, any comments to just get this going?
So Inglewood, come on up, and then. Yeah, and you can introduce yourself. It's a condominium complex down off of Berry Avenue on Broadway Street. It's transient with the owners that come and go a lot. So,
Please sit down.
yeah, go ahead.
Have a seat.
And once it's to have someone staffed on it, they're not always there. So we have done this practice in the past. We have given you a list of resorts and even the most previous ones. So we'll let them discuss why they decided to come before you.
Okay, so just for the minutes, just introduce yourselves.
Carl Neoff, owner,
Okay.
treasurer of the board of Englewood Condominium Beach Association.
And my name is Solveig, also known as Sunny, because it's a little easier. Lund. I'm also an owner, and I'm also a member of the board of the condo association.
Great, welcome.
Thank you. Thanks for having us.
Okay. So, and why are you here tonight?
So I know that we are brand new members of the board, but we heard that the previous board started the process of trying to have some relief from the requirement for CPR certification for the pool, because it used to be that some of the units were timeshare units, and they were eliminated in 2022. So as of now, the condominium consists of 19 privately owned units. There are no more timeshares. Some of us live on premises year-round, And some owners are only there for a month or two in the summer. Currently, there are a few units that are rented to year-round tenants. We do not permit short-term tenants there. And so when the previous board started the process in 2023, I think they didn't really know, I don't think they got very far, but they had been in discussions with Mr. Renault about this, the procedures and what would it entail, and how could we not have to have the CPR certification for all the owners, and at the same time provide a safe environment and a safe swimming pool, both for owners, occupants, and the neighborhood. So that's what we believe that we've been able to do. And so we would like to have a variance from the CPR certification.
As well as lifeguard, not to have a lifeguard.
There's never been a lifeguard there.
yeah.
Yeah.
Okay, board members have some questions, comments?
Yeah, Ms. Lund, did you say there are no short-term, like renters, like in the summer or anything?
Nope. No, there's only yearly tenants there now.
So that's not allowed? Is that in the deed, or is that?
No, it's part of the rules and regulations that short-term rentals are not wanted, desired, or permitted on premises.
I have a question.
Sure.
Under your pool rules and regulations, it talks about the owners who are users of the pool. They're required to get training in pool chemicals and testing, and must commit to testing the pool and keeping accurate records as required. Does that mean you don't have a pool technician who takes care of that for you?
No, we do have a pool technician who comes in, I believe, weekly, but the pool was not open last year because there was construction going on the pool area, so it wasn't deemed very safe to keep it open. But the year prior to that, we had a system where when an owner first opened the pool in the morning, before anyone was allowed in the pool, it would be tested. And it would be kept in a log, and that would take place 4 times a day. We are not seeking a variance from that requirement. So in addition to the pool technician coming in and overseeing the pool, the owners are still responsible for daily pool testing and log keeping.
So is that assigned, or is it just depend on the first person to use the pool to know that they need to do the testing?
It's the first person who opened up the pool, and if they stayed at the pool, we would have a log where it would be distributed evenly throughout the hours that the pool would be open.
Does that answer your question?
One other question. You talked about a safe pool for your owners and residents and the neighborhood, but you are not letting anyone other than owners and residents utilize the pool, correct?
That is correct.
Thank you.
Sure, thank you.
Anyone else?
Mr. Chair, as you can see, Phil has provided you a list of other establishments in the past that have asked for the same variance.
Right. Yeah, We've had at least one of them come before us.
Yes.
that
Yeah,
current board.
so is there a request for variance also for the water safety certification? Because a lot of those other pools have requested that, as well as CPR and the lifeguard. And I don't see that on the,
Lifeguard's not required, so.
no, of course not. What I'm asking is, are they requesting water safety certification variance on that? Because it looks like a lot of the pools have 3 things there.
Yeah.
I didn't see that on the application, and I'm not quite sure the details of the water safety certification, what that means. But it looks like a lot of the pools have a variance, I guess, in not having the certification.
I think that's the same one, kind of, it falls in the same line as the CPR. But they do have the CHO, the certified CPO, Certified Pool Operator, that does their maintenance and make sure all the equipment's still up to standards. The emergency phone is up to standards, the lines, all the lines are painted, numbers are painted, stuff like that are they're not asking for a variance for that.
Okay. At some point, why don't you just get back to us, just what exactly the water safety certification's all about? I would have known that if I hadn't seen all the other pools that looks like they asked for that variance. When was the last time the pool was inspected?
That would have been in the summer of '23 because it was not opened last year. It was
Right,
totally
okay.
shut down.
And what's the approximate size of the pool? What kind of pool are we talking about?
It's roughly 22 by 32 feet.
Okay. And are pets allowed in the area of the pool?
No,
Okay, I'm not sure that's in your regulations or not. I don't think it is.
no,
It's
I
not-
mean, we have a strict pet policy anyway.
Okay.
It's only for service animals and emotional support dogs, but
Sure.
they're not permitted in common areas.
Okay, all right.
So
Pretty straightforward. Anybody?
They know as soon as they, when the season gets closer, that they're on the list to be inspected, Phil will go out and do a full, complete inspection for you guys.
thank you.
Yeah. Larry, I've gone on, just when I first started on the board. It's interesting just to do an inspection once with Phil. He's great. So, something to keep in mind.
Okay.
I think the rules and regulations seem very, very comprehensive and fairly strict. I guess I just hope that all of the owners are self-policing, because I don't know that anyone else is going to be making certain that these are all honored.
Can I comment on that?
Yes.
Of course.
So we had actually an owners meeting last week where this came up for discussion. And I do have to say that all of the owners are, if I might use a good word, mature people. And they were very concerned about, enforcement of the rules. And I think last year, it was also strictly policed because we are very concerned about the safety. There are children on premises. And, if someone isn't following the rules, no one is afraid to say something. But I personally have no concerns about that. Most of the owners are into their 50s and 60s. We have a couple of younger families with children, but last year or 2 years ago, they were also very good about, keeping their children in check and behaving around the pool. So there was never a situation in my mind that I thought, this is really not safe. It's a fairly law-abiding group of people who live there.
Do you allow owners to bring guests?
The owners can bring the guests into the pool, but if they have guests staying in a unit, guests are not allowed to be unsupervised without an owner in the pool area.
Okay.
And so therefore, we also have a strict policy with a key access to the pool. Only the owners are allowed to have the key. The year-round tenants are allowed in the pool area if the pool has been opened by an owner, but they are not permitted to have a key, and they're not permitted to be in there without an owner being present. We've also implemented some stricter control over that, because for anyone to be able to use the pool, they have to meet with the board and get a thorough introduction to the rules and regulations. And we have a signing sheet where they need to sign to acknowledge that they will adhere to the rules. And if they do not, their pool privilege will be revoked.
Okay.
And because we're a small property, we know exactly who's not supposed to be there or not. So I think it's oversight in itself.
Okay, thank you.
So, it's time to make a decision about whether to grant a variance or not. So if anyone wants to make a motion, that would be helpful.
I'll move that we approve the variance request for 60 Broadway, West Yarmouth, Englewood Beach condominiums, pending a successful passing inspection prior to the commissioning of the pool for 2025.
Well stated.
Second.
Thank you. Great. Any further discussion? Larry, anything? Anyone? So let's vote. All in favor of granting the variance, just raise your hand, say aye.
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 Unanimous? Great. Okay. All right, enjoy the pool.
Very much
Thank you.
appreciate it.
Thank you.
Okay, number 5 here is Outer Cape Healthcare, Brian Smith, overview of services provided. Barry, yeah, I'm not sure what's up tonight.
Brianna's on the Zoom right now. Outer Cape Healthcare, she's going to go over the services we provided. And so last meeting, we talked about helping people that with hoarding issues, with mental illness and stuff like that,
Yes.
and what we could do. So I reached out to Brianna. I've worked with her in the past on several situations, several occasions. She's a wealth of knowledge, wealth of resources, and she's going to tell us a little about what she does and how she helps our town and other towns. So
That's great. It's really a complicated issue for sure. So welcome. Hello? Brian?
Liam, what?
Can you hear me now?
Yes, we can.
Yes.
And she did send some slides in, so we have the slideshow over here for you.
Okay, thank you. So we're anxiously awaiting your information for us to get started here.
Right,
Apparently,
sure.
we have-
If I am able to see the slides on my screen, I don't know if that's possible.
You can just tell me if you want, I can move through the, oh, there you go.
There we go. Thank you. Oh, nope.
You tell us which slides you want, we'll have it up on our, sorry about that.
It's okay. I think it might just be picking up on me because I'm the speaker and then hopping off the slides over to my blank screen because I'm the speaker, but that is okay. I will pull them up in the background for myself. 1 second. Unless you're able to take the view off speaker.
Liam, can you do that?
She can pin our video. It's on her end.
If I start talking, will it jump to me?
If you,
Okay.
he said if you pin the video on your end, you'll be able to do it.
Sorry, folks. Talk amongst yourselves. We're only 5 years into this.
If you can see your slides on your end, we can show them on ours.
Right. That's what I'm going to do because I don't think I can pin things with the view that I have. So, my name's Bree. Thank you, Barry, very much for the introduction. I am the Director of Behavioral Health at Outer Cape Health Services. And Barry asked me to come here tonight to provide some information regarding what Outer Cape Health has to offer as a community health center, and in particular, probably a few of our programs, which I'll get to in more detail. Next slide, please.
You're up.
So Outer Cape Health, we provide, and we are a federally qualified community health center. So we provide primary care, we provide behavioral health services, we provide recovery services. In particular, I've worked with Barry in the past regarding our Community Resource Navigator program. And then we have some other additional supports that we offer at the health center. I'm not sure everybody maybe knows about us as a community health center, not just a doctor's office. So I was just going to go through some of what we have to offer. Next slide, please. We are a primary care provider. You're looking at the lobby of our Harwich office right there. We have health centers in Harwichport, right on 28 across from Saquatucket Harbor. We have a clinic in Wellfleet, and we have a clinic in Provincetown. Also in Wellfleet, we have the AIM Wellness Center that just opened the fall. I'll talk a little bit more about our recovery services that happen there. So we provide primary care, that's pediatrics, all the way up. We do have one midwife on staff, Jody Belson, who works out of all of the clinics. So we have primary care. Next slide, please. We also have behavioral health services. So we provide a few different behavioral health services at the health center. We have psychiatry. Most people are pretty familiar with that. That is a medication management for mental health concerns. So some people choose to take medication for mental health issues, and that would be psychiatry. So we do have psychiatry at Outer Cape Health. We also offer psychotherapy, so traditional therapy, what most folks might think of when they think of going to see a therapist. So we have about 8 full-time clinicians that work as a long-term individual therapist at all of the health centers as well as remote. And then we have collaborative care. That is a short-term brief treatment model for behavioral health services. That's for mild to moderate type of behavioral health issues, maybe grief, life transitions. The whole thought there is if we can get people timely, appropriate care, we can keep behavioral health issues from growing into longer, more severe, persistent mental health issues. So we offer, again, our behavioral health services both in person and remotely for all of the health centers. Next slide, please. We also offer recovery services at the health center. So we do we have an OBAT program that stands for Office-Based Addiction Treatment. Some folks might also know that as MAT, Medically Assisted Treatment. And that's for individuals that have substance use disorders that a medication is helpful in their recovery process. So we have about 200 patients that are in our OBAT program, and that is again, at all 3 of our health centers in Harwichport and Wellfleet and in Provincetown. We do not prescribe methadone, but one of the things that I'm most proud about the health center is that we work very closely in collaboration with other, not only town departments, but other medical facilities or human service providers. So while we don't provide methadone, the comprehensive treatment centers in Yarmouth does. And about 2 years ago, maybe, they have one mobile unit that for all of New England, and they asked if they could utilize that on the Outer Cape so that we didn't have folks from the Outer Cape having to drive down to Yarmouth every single day for their medication. So we now have a methadone van that parks behind our wellness center in Wellfleet 6 days a week in the morning. So very happy to be providing that closer to home for lots of folks. We have, oh, there they are. Oh, no, they're gone. We have a day treatment program that happens at the Wellness Center out in Wellfleet, and that is an IOP program for anybody who's familiar. So lots of times folks with substance use disorders might decide to go to detox or to rehab or an inpatient level of care. Other folks at times decide to do outpatient work, which might be therapy, which is 1 hour a week. But that middle level of care is what's considered intensive outpatient. Not a whole lot of places do that. Gosnell does provide that on Cape, but they have closed the offices that have been closest to us. So we took on the venture probably about 5 years ago to start a day treatment program that runs now in person in Wellfleet. That runs Tuesday, Wednesday, Thursdays from 9 to 12:30. So the participants get about 12 hours a week of substance use support. That's comprised of groups focusing around early recovery skills, relapse prevention, long-term recovery planning. That was running virtually until we were able to open the Wellness Center in Wellfleet. And we also offer recovery coaching. We work very closely with the towns of Harwich and Chatham through their opioid remediation funds to support some specific recovery coach support. So we have recovery coaches on staff who are in recovery themselves. It's a one-to-one peer-based model. They're able to help them connect with services and supports related to sobriety and recovery and whatever that means to them. So that is a wonderful treatment model that we have in addition to the behavioral health and the medical services regarding substance use disorders. Next slide, please. And then, as I mentioned, we have our Community Resource Navigator program, and that is where Barry and I have done some work together. That's an outreach service that's provided for free. It is essentially a community health worker program for anyone who's familiar with community health workers. So we provide information regarding available programs, supports, entitlements, benefits, and then we help folks connect to all that support and help that's out there in the community. So we help people navigate community resources. And we do that by, next slide, please. We are assessing for social determinants of health. So when we meet with folks who can be referred from anyone and everywhere, including the health department. So I've worked with Barry with regards to some homes in town. So people can self-refer, other agencies can refer. We work really closely with health departments, police departments, councils on aging, but we ask about these types of issues. So food security, so do you have access to food, and really being mindful of it's not just access to food period. Is it nutritious food? Is it culturally appropriate food? Is this food that you can prepare in the living quarters that you have? Are you able-bodied enough to be able to do meal prep and make yourself meals? So asking about food, but in detail about food. We ask about housing. So what's the housing situation? Again, really going into, is this year-round housing? Are we doing a winter rental, campground, or summer rental shuffle? Is this safe for you, for your family? Is this affordable? We ask about transportation. Is there reliable transportation depending on where you are on the Cape? This varies. Is it reliable? Is it realistic? Financial issues. Are people behind on their bills? Are we having housing instability because people are housed low, behind on their bills? So we prefer any programs that are low barrier and strength-based. We love the Needy Fund that covers the town of Yarmouth. Always very, very grateful for all the financial assistance out there. We ask folks if they need any behavioral health or substance use supports, or if there's any misuse that's concerning for them. Community involvement is another one of the biggies. Folks need connection with others. They need a sense of purpose. We need to have support. So it's important for us that we're really helping people develop their own care team. So we ask about social determinants of health, and we listen, and then we help connect people back to the programs, the services, the agencies that are able to provide some support. So similar into a situation that Barry may have mentioned, if there might be a hoarding situation, there's a lot of help that's needed there, not just behavioral health support in addressing maybe a hoarding concern, but there's a very practical clean out of the house. There's trash pickup and disposal on an ongoing basis. So there's a lot that goes into any particular situation. So we assess for social determinants of health. We help connect people back to what's available to them. Next slide, please. We like to be very involved in the community. We sit for office hours where towns in which we contract with them for specific support, either through recovery coaching or for the navigators. We sit for office hours. So I'm not a huge fan. Well, now my camera's off, but now you can see me on Facebook. However, the police departments think it's hilarious. So I sit at the Eastham, Wellfleet, and Truro police departments for office hours every week for people to find us. You can find us at libraries, councils on aging, schools. So we sit out and about to make ourselves available, but really the bread and butter is we do home visits. Next slide, please. And then what I think is, one of the great parts as well is that because we're working in the field and we see people at home, that we get a lot of real-time information regarding what are gaps, what are barriers, and what are ways that we can be supportive of our communities on what I would say a meso and macro level. So we like to work in collaboration with our partners and our friends. So one of the things that we did on the Outer Cape was we started a cultural prescription program with one of the art museums, PAM. They gave us canvas-free museum passes for patients that were lonely, that were isolated, that needed points of connection. Then we were able to find some funding to bring them on site to run free art classes. We've done 4 cycles of that, and patients love it. So a cultural prescription program, very popular as an adjunct behavioral health treatment, certainly good for recovery as well. Next slide, please. We run a food is medicine program. We do enroll people in the town of Yarmouth in that. That is what started as a small pilot of 25 individuals working with Sustainable Cape in the Truro Farmers Market has now become a covered benefit throughout a lot of advocacy, a covered benefit under Mass Health. One of their ACOs where now this is paid. So we are able to enroll this year 75 residents on the Cape in this produce prescription program that is free deliveries of produce every other week in the winter and every week during the season at the Truro Farmers Market. So not only are we able to provide some food support and be combating food insecurity in the area, but also very much helps our local farmers when they know that they have 75 people that will be buying from them that week. So the Food is Medicine program is very popular. Next slide, please. We got a federal grant to embed into or open what's considered a school-based service site. So we've embedded into Monomoy High School. We have a community resource navigator that sits there full-time to help connect students, families in the school with any social determinant of health need. We have a dedicated therapist who's actually practicing hybrid. So she's in person 3 days a week and virtually 2 days a week. A dedicated therapist just for the high school students. And then we have one of our lead pediatric primary care providers and our women's health midwife who are able to provide medical appointments, all either in person or by telehealth from a location at the school. Next slide, please. And we are also, I'm sure you are familiar with, or if you're not, Behavioral Health Innovators. That is an agency out of Chatham. They started the Alternative Peer Group, which was one of the only and best substance use supports for youth in the area or on Cape Cod in partnership with Duffy Health Center. We were approached a few years ago about being the clinical partner for them at PASS, the Positive Alternative to School Suspension. Now has been renamed the Positive Alternative for Student Support because students do not have to wait until they're facing suspension to go. They can opt into going. So this runs out of the high school version is at the Centerville Rec Center, which is where you see there. We have a clinician that screens every student for anxiety, depression, trauma, and substance use. We then make recommendations back to the family and the school regarding any ongoing care, and we hold reentry meetings. And you can see there from a DY is a sending partner at that school. So students at Dennis Yarmouth High School have an option to go into PASS if they are facing suspension. Next slide, please. We're always happy to do community education and training, routinely do the QPR trainings, which is a 1-hour suicide prevention training. I do trauma-informed care trainings for the community as well as for town staff. I will say I let my mental health first aid certification lapse, but that was an 8-hour training. That was a very long one, but I've done those for police departments in the past, town staff, as well as other human service agency staff. Next slide, please. And then lastly, I will just say that in addition to primary care and behavioral health and recovery services and our navigator program, we do have some other services at the health center. We have pharmacies in the health centers. We have Quest Labs in the health centers. And the Harwich office, we have a WIC office, which is Women, Infants, and Children's. We have Healthy Connections workers at every location that do insurance enrollment. We have a sexual health test and treat program in Provincetown. And then because Provincetown is so far away, we do have some specialty services, including dermatology, infectious disease, radiology, and ophthalmology. And next slide, please. I'd be happy to answer any questions.
That was great. Thank you. I didn't have a clue of how extensive your services are. That's great. Thank you.
Bree, what's your funding? Bree,
For any particular program or the health center in general?
for the health center in general?
Oh, I wouldn't be able to give you the exact spread. I mean,
Okay.
we are a federally qualified community health center, so we do get a significant portion of our funding from the federal government. Otherwise, we also, I would say the general two other buckets, because I'm not in development, would be development, and we are a doctor's office and behavioral health office, so we do bill to generate insurance revenue.
That federal support, is that, you suspect that might be in jeopardy, or is that fairly
That
well
would be above
established?
my pay grade, thank goodness, to
Pardon?
speak to. I would not necessarily know about the details of that.
Okay.
Could you tell us how many staff you have in your behavioral health department?
It's about, I would say, 25. Actually, if we want to include the psychiatrists and the OBAT nurses, it's probably closer to 35 staff. But between the therapists and the navigators and the recovery staff is about 25
So
members.
that's just in behavioral health, and then you've got the other areas that you told us about.
Oh,
So-
yes, Outer Cape Health has about 230 employees.
Okay, thank you.
You're welcome.
You do a lot with that.
We certainly try our best.
As for social determinants of health, you help people with medication. In other words, cost is a problem for a lot of people here, and it looks like it's going to be a greater problem for people on fixed incomes, and a question about insurance.
Yes. Anytime that there's a difficulty paying for anything, it's looking at the options of, is there a way we can reduce the costs or get some help with this actual thing, or is there ways we can offset costs in other places? So if somebody's having issues paying for their prescriptions, of course, we're going to look at things like can we get you connected with someone to look at your insurance coverage, or is there any financial assistance to help with copays or a deductible you might have? Or sometimes we have to get creative and say we can't really do anything about the cost of your prescription. Your insurance is what it is. Are there any other ways that we can help? Are there rental assistance programs we could get, or food support to help bring down your expenses somewhere else? But finances are something for all of us, including our seniors.
Thank you. One reason, I think, the reason why you probably are speaking here tonight was the issue of someone potentially having a hoarding disorder. And would you be okay if I just presented a very simple fictional case and just
Sure.
to get your ideas about it? It's something.
I love that.
Okay. Let's say you have a 68-year-old person living alone, doesn't have any family, and is living in an unsafe environment and is refusing any support. So that's the case. And I don't think it's an uncommon one here on the Cape with people who have a hoarding disorder or suspected one. So we welcome any ideas, because I think we probably
Sure.
have that problem.
So I would probably start to look more at what's being deemed unsafe. We come up against all of the time people not wanting help. So it's not always the case of somebody has a need and they're not able to get connected or they're not aware. Sometimes it's that somebody says thank you, but no thank you. So thinking about what is making that situation unsafe. And I'm sure, obviously, because I'm speaking to the Board of Health, it's come to your attention as the Board of Health. So what are the possible ramifications, or what are the adjustments that need to be made, as opposed to sometimes we have, maybe family members or neighbors or whatnot that don't like the condition of someone's home or the way they are living, and then there's not a whole lot we can do if the person says that this is what I want to do and no thanks. So at the end of the day, for us, it's all about establishing a relationship and a rapport. I think I've worked with a few people with Barry that, it's not always the easiest thing to come in and do and try to align with someone when they're feeling threatened, their own perception of what a situation is. So trying to figure out, like I said, what exactly are those safety concerns and at what level of those safety concerns. If they went left unaddressed, what are the possible ramifications, which sometimes it goes down that path. And then would the person be willing to at least start to work with someone to look at the issue, address it in their own pace and their own time? So I guess that's a very social worker way of answering your question.
So people have gone to a home and trying to speak with someone who's willing to talk a little bit, or the person who doesn't want to talk? How do you get therapy started, so to speak? It's a disorder, a difficult one to treat, and we all talk about getting a dumpster, in the yard, but that's not going to be the answer overall for treatment.
Right.
What we're scared about is if newspapers are stacked up everywhere and you can't even get to a door. Obviously, there's a danger there, and some of these people have insight into what they have, and some of them don't of their problem.
Right. So, I think that that is where it can be really valuable. I think that the beauty of the Navigator program is it's very non-judgmental and non-threatening, because we don't go in as a therapist, because a lot of people don't necessarily want to talk to a therapist or don't think that they have a need to. So when we go in, and I'll say I still practice as a navigator. I'm the director of behavioral. I've been with Cape Health for 8 years, but when I started as a navigator, and that's still the capacity in which I go out and see folks. So being able to go in there and hear from them, even sometimes how frustrating it is to have, neighbors complain or the Board of Health coming over or whatever it may be, going in and not having an agenda about what they need to be doing, and really just kind of listen and see the big picture. And sometimes it is something else that they want help and assistance with, and kind of baby stepping it to, at some point, maybe somebody recognizing that it's maybe a mental health condition, that they want to speak to a clinician about it. But exactly to your point, like I said earlier, it's not just a matter of connecting them with a therapist. Then there's the practical matter of actually cleaning the place out. And it's just a lot goes into a situation like hoarding, and it's not always hoarding as well, just because there's a lot of stuff. So I think that that's where it can be helpful. If I myself am able to go in as a clinician and sometimes tease a little bit of it out, whether or not it's actually hoarding or it's a situation that's gotten out of control. So that's what I would say, is we don't go in off the bat offering therapy. We go in just kind of being curious about how somebody's doing, and oftentimes that enables us to continue a conversation, which hopefully leads to some progress.
Have you ever needed legal services? In other words, what you're entitled to or legally can do? I could see that being a problem. You're on somebody else's property who doesn't want you there. So I'm not trying to make this difficult, but I think it's practical. We need to know this from somehow.
We don't go where we're not invited. It's all completely voluntary.
Mm-hmm.
So I might co-respond. I might go out with someone else, but us and on our own do not go out uninvited or unannounced. So we might go out with a health agent to introduce ourselves, and hopefully make a time for us to come back and speak with them afterwards, which usually works. Other times it's leaving our business card or information, and the person can reach out, and sometimes the person flat out says no, and we respect that. So do we access legal services? Yes, for other types of things, because people have legal matters, but not in the case of, how we do our work. We're of course covered out Outer Cape Health policies, but we're not going in to do anything somebody has not asked us to do.
Okay, that's clear. Thank you.
So, Barry, if you had a situation in Yarmouth that you were concerned about, how would you deal with, could you approach Bree about?
That's how Bree and I were introduced, yeah. I go out and I assess the situation. If the person is beyond my scope, I'm more than happy, Bree's always more than happy to quickly get back to me. I've worked with her on 3 or 4 cases. We've done great things together to help homes and people in need this situation, so.
Can you think of a case, like a pending case that you could?
I have 2 in mind that definitely I'll be reaching out to Bree in the near future on to see how we can work together and pick our brains together and get together to do this, so.
Can a Board of Health members help out, or is that something we should just?
Again, like Bree said, it's very traumatic if, I show up, I'm not a small guy, I show up in a big marked car and somebody else shows up. And sometimes it's better just, if I go and just knock and talk to them, say, hey, do you mind if are you willing to get some help? I have a great connection. Her name's Bree. Can she reach out to you? And that's a good foot in the door. I give Bree their information or give them Bree's information, let them connect together. And then once they get the relationship established, then Bree and I get back together, and then we continue to work together to help these people.
Do any of these people have pets?
They've been relinquished.
I see.
Yeah, both of them that I know of have already been relinquished, so.
Because my thought is, as a veterinarian, maybe that's one way I could help.
Yeah, they've
in a non-confrontational
Yeah.
way.
The 2 situations that I can kind of think of, both the pets have been relinquished to friends or family, so.
Was that voluntary relinquishment?
Not necessarily, but they saw the big picture and they knew it was for the best.
Yeah, I'm just thinking that might be an approach, though, with a certain person, if they did have a pet, if we could make the pet the focal point.
Yeah,
That we might be able to approach the whole issue from that perspective.
definitely. It's a great avenue to try, so. I'm sure Bree would agree with that also.
People do lots of things that they'll do for their pets that they won't do for other people, so
That's been my
absolutely.
experience.
Bree,
Yeah.
can you tell me of the hoarding cases that you've worked with? How many have been successfully resolved or at least remediated somewhat by your approach, which sounds very reasonable and kind to me?
Oh, I don't have any sort of stats off the top. I think what is resolved and, kind of addressed varies by the circumstance. And it certainly, I say runs the gamut from, I won't pretend here, from people saying absolutely not, to, I worked with a woman who had an issue with hoarding and reached out to me when she was 86 and worked almost until her passing. Did we ever clean out the house? No, but was she working on it? Continuously? Absolutely. So there's a lot of different outcomes. Sometimes it's just dealing with what is bringing them to your attention and having kind of the bare minimum that's an option, and for some people that's what they're willing to do, and that's what will be acceptable for any code violation. So It's hard to say. I won't say they're all wins, but do I say more times than not, the far majority of the time, are we able to at least make some headway and progress? Absolutely.
Well, I would call those wins.
Well, thank you, Eric.
One of the big ones that Bree and I worked on, it was just, they simply just couldn't, they didn't have money for a dump sticker, and it just had piled up and piled up, piled up, and Bree was able to get her resources and to get a trash truck over there to empty out the garage and stuff like that. And I've driven by this house, and once it was done, it wasn't, it was 99% better than what it was originally. But when I go back, and it's definitely not where it was, but it's still not where it was at all. So it helps. Sometimes it's just little things like that. Just, hey, we can do this for you. It's definitely not going in and making Taj Mahals out of these homes, but just little things. Just like, and once they get behind, it's scary for them. They get overwhelmed with it, and we just help them take that extra step and just take that extra little burden off of them. So
it's that kind of person probably doesn't have a hoarding disorder or obsessive compulsive disorder that's interfering. It's poverty is what you're saying.
just kind of,
Right, or a situation out of control, as Bree said.
a lot of times it's people inherit it from their folks.
Yeah.
And they're like, what do we do? I don't have money to get 18 dumpsters out of here. So,
Right.
and it just, over time, it builds up, and they don't see it building up because they live with it. But from the neighbors, they see it, but what little we can help with, it makes it nice. And the last property, I don't know if I worked with Breon, but I got a very nice thank you letter from the homeowners for what we did for them. So
Great,
it's,
great.
It's terrific. Anyone else? Any questions or comments? Because this has
Thank
been
you,
really
Bree,
helpful.
Thanks for the presentation. It was very enlightening.
Bree, thank you for letting me reach out to you.
Thank you. Welcome, or more than happy to come back anytime.
Okay.
Always happy to talk about what we're doing.
Okay. Thank you. Be well.
Thank
Cheers.
you. You as well.
Thanks. Okay, we're up to number 6 here is the green burial. It says it's for a vote tonight. Hopefully everyone got a chance in there to read what I suspect is the final version of the green home burial regulation. So, board members,
So this is going to be
I have a comment.
this is going to be a vote to move forward to the public hearing, and then we can go from there. So
but it's a vote first on the regulation, and
Yeah.
if it passes, then we would go to an open
Correct.
meeting. Yeah, okay.
I have one comment, and I hope it doesn't delay anything, but on the paragraph beneath health regulation for green burials on private property in Yarmouth, Massachusetts, the last sentence in that first paragraph is missing one word. The last sentence should read, each green burial must first and finally be reviewed and approved by DEP.
where are we at again, Mary? I apologize.
That's all right, but it was there originally, right?
What paragraph we on? What page?
Oh, okay,
Page 1.
we're on the first paragraph of the actual regulation. And it's the last sentence that reads, each green burial, and there should be the word must first and finally be reviewed and approved by DEP. And that word must is not there. It should be between burial and first.
So it's essentially the second paragraph on the page.
Yeah.
There are four lines, and it's the fourth line, the word, and it starts with burial.
Each green burial must first and finally be reviewed by DEP.
That's a simple fix.
Right, good, yeah. Because that was when we made our original comments. And I think it was just a omission.
Good pickup. Thanks, Mary.
That's all I have.
Well, that's positive. Anyone else? Okay. I don't know, is someone interested in making a motion here, finally?
I
Anyone?
move that we accept this draft version of the Green Home Burial Regulation for Yarmouth, Massachusetts,
That one edit, right?
with that one edit, yes.
I'll second.
Okay, any further discussion? Anyone? See, there's none, let's take a vote. All in favor of passing the regulation, raise your hand, and say aye.
Aye.
Okay, it's unanimous. So, regulation is passed, we have one. So once you see, okay, Mary, okay. Don't get up yet. Anyway, so what's the next step?
Next step is move forward to the public hearing.
Okay.
So,
And how soon can we have that? How about the next meeting?
that's fine.
Yeah, okay.
But we also need to come up with an application process and a fee process.
Right.
So,
Okay, so maybe that needs to be done before the meeting?
yes.
Okay, so there's a stumbling block, I guess. Can that be done remotely? Can we do this or not? Or what do people think? Or do we need to have another meeting to produce those two documents?
We can put together an application, and then I would like the board to decide an appropriate fee. And then we can put that on the application also.
Sure.
So if you want to discuss that now, we can do the application and the fee, and I can present it in front of the next meeting, so.
Okay, okay. So what would be a reasonable fee? We don't have any precedents here to
We're
look at.
talking about the application that's in front of us now.
Yes.
The one that we've already seen.
Yeah, for the green burial.
Represent that application.
Yeah, so we're gonna formulate an application, and with that application, there needs to be a fee attached to it, so.
And the application will basically be a checklist, right?
Yes, ma'am.
Yes, okay.
We'll go through this, the green burial regulations that we just voted on, and it'll just be a checklist.
Right. So, which sounds simple, but it's going to be a bit complicated because of all the different things that are involved. What is a reasonable fee, do you think, Barry?
I would say $250.
Good, that's exactly what I thought.
Why would there be a fee?
We have fees for everything, hence, we're gonna go over all that in a little bit, so. And it's a time consuming, as
Yes.
we all know.
Yep.
We have to review
Yep.
it, we have to go, it has to pay for itself, so.
Sure.
Right.
Also,
I mean, hopefully
site
we've
visits
covered
as
all
well.
of the different things, but we might not have,
We've
so it
spent-
could be complicated.
I've spent hundreds of hours on this so far.
Yeah.
Yep.
So it sounds like we need, the next meeting, deal with the application then,
Yep.
and then the following meeting could be the open meeting.
Yep.
Public meeting. Okay. Mary, any comments? Eric, Larry?
Do you need a motion for the fee? Because that's what Barry needs
Yeah.
from us right now.
Sure.
I move that the fee for the application for the green home burial be $250.
Second, anyone?
Second.
Good, thank you. Any further discussion? Let's vote. All in favor of the stated fee, raise your hand, say aye.
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 Okay, it's unanimous as well. Okay,
We got that down, so we'll start working on getting the application together. I can send out drafts to you guys, just so you can review it. We can
Okay.
email 'em, and then I'll get once we get back from you, we can update it, and then I can get it in your packets, and it'll be a quick vote and next meeting, so.
Sounds good.
right. There may be an application out there somewhere to,
It's-
yeah,
yeah,
just-
we-
I believe
with-
there is,
With our,
to use it.
OpenGov program,
Yeah.
and we can take the housing one or another one, and we can just
Yeah.
go from there,
Right.
and then just get all these bullet points in there, so.
Great. Okay. Number 7, we're up to. It's the update on rentals, pools, and housing permits.
I got that for you.
Right.
As of March 15th, we have received 2,577 rental registrations. In comparison of that from a year earlier was, the total year of '24 was 3,186. So that means we've already gotten over 81% of last year's total by mid-March, which is great. And Deb got me these numbers 2 weeks ago, so these numbers have even gone up even more. So we're doing really good on our rental registrations. Again, now that we're down an office assistant, Sarah has a lot on her plate, so we're still getting them out. My housing inspectors are working hard every day, making calls, setting up inspections and everything, so they're doing great there. And then Phil just got me his food and retail tobacco motel stuff. Out of the total of 159 food establishments, the annual is 119. 2 have not been received yet, just because they're remodeling, and the seasonal 47 haven't been moved yet, just because again they're seasonal. We're not surprised by that. Retail food tobacco, all have been received, all 44. Retail food and tobacco, motels and lodges, we have 59. 19 of them have been done. 1 is closed for renovation, and that's the Yarmouth Resort. They're closed for right now. And then the seasonals, 17 have not been received yet, but they're all coming along, like similar with the Inglewood pools and all that. All the outdoor pools Phil's gearing up for a busy time right now. So
Sure.
he's got a lot going on. All the annual pools have been done, and 88 of the seasonal pools. So this is Phil's busy time, and I'm helping him as much as he can, but he's been doing it for 21 years, and he knows he's got a good system going down. So
He's not underwater, so,
not at all.
Good work.
yeah. Okay, we can move on. Number 8, let's review and approve minutes from March 17th, 2025 meeting. Anyone? They read it over?
I move that we approve the minutes for the April, for the March 17th, 2025 meeting.
I second.
Thank you, Larry. Any comments on it? Anything need to be changed, added, whatever? No? Good. All in favor of passing the minutes for the 17th? Raise your hand, say
Aye.
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 Okay. Done. And it's open, let's see, we got new and old business next.
So for the new and old business, a couple things. There is a open meeting law training that will be sent out to the board members, just so you guys can update yourself and be familiar with the new rules and regulations of open law meetings. So it's a link, you can watch it. How long is it, Sarah?
It's an hour.
It's an hour. So it's good to know what we're supposed to be doing, what you're supposed to be doing. So we'll get that information out to you.
Appreciate it, that's great.
The second thing is, sorry, Mary, you don't have it. We do have a list of all of our fees. We have been asked by the select board to review our fees. The board does set the fees. We're not looking to go up by a percentage on every one of them. We need to justify the reasoning for increase the fees. So this will be brought up at the next meeting. I just wanted to give you this just to
Okay, that's helpful, thanks.
get this going. And Mary, I'll get you a copy of this. We'll get it emailed to you.
Okay. You could just email it. In the past, what we have done is looked at the other communities, towns on the Cape,
Yep.
what fees they are charging, and kind of use that as a touch point anyway for
And
what
we
we are.
And we
what
are in the
our fees
process
are.
of getting information from the other departments around
Good, good.
And I'll get you that information also prior to, so. Like I said,
Great.
the select board, I was at the select board meeting last week, and this is something every department they're getting asked to review, so.
Right, right. I have one item from the RAC meeting.
Just one, Mary,
Um,
just still on this permit fees, I just had one question.
Yes, sir.
Is there anything that jumps out at you, Barry, on these fees that you should bring to our attention? Or
There was, no, not really. They're all pretty common. We're thinking about actually maybe condensing some of them instead of having this and this, and maybe just make it a little easier. If we can, maybe you want to think about condensing it to be one fee, so. And as you can see in the food permits, there's a lot of them. Motel, there's some, so. It's all, and there isn't any on here that don't jump out to me that we don't do, so. And we'll be adding one more. The
You'll
green
be
burial.
adding the burial permit
Yes.
application.
Yes, ma'am.
They'll like that. So I have one comment from the RAC meeting, because I go and I listen and, from a Board of Health standpoint, there aren't a lot of things that come up. However, on the agenda tonight, the OPM said that they had requested a waiver from Mass DEP on the total organic carbon that's being removed from the treated wastewater that's going to be going to Bayberry. And I asked if this had become an issue when they had requested to increase the amount of effluent going to Bayberry. And they said no, that this was always an issue. But I hadn't heard it come up before. But because it's zone 2, there has to be this waiver. So, total organic carbon, frankly, isn't something that I have heard come up in our Board of Health meetings. So, Barry, do you have anything you can tell me about that?
Mary, that's the first I've heard it also, so I'd be more than happy to do some research on this. and do
Okay.
it. I know I did go out a month ago when they were doing all the test holes at
Right.
Bayberry. They did nine test pits, and they all were very good, exactly what they were looking for, so.
Good, yeah. This is treated wastewater, but apparently it is not up to what DEP requires for being dumped in a zone 2. So,
Mary, do you ever get, do they ever have reports on wastewater or reclaimed water that's produced from facilities that are already in production? Does that question make sense?
In production, meaning what?
Like, it would be interesting to see a report done on effluent water that's coming out of a reclamation facility or a wastewater treatment facility so we knew what was being applied at a facility like Bayberry or one of the golf courses where they'll be using the reclaimed water for, I assume, for irrigation purposes.
Right.
Wouldn't that be regulated to begin with?
that would be the regulation rather than what other people are doing. It would be what DEP requires.
Well, I guess my question is that information that's reviewed by RAC, or is that something that we would maybe source on our own if we were interested?
No, I mean, we don't look at other communities' wastewater treatment efficiencies or results.
Okay.
And frankly, on the Cape, I mean, Orleans, I think, is the only town that has progressed that far with wastewater treatment. but it's actually, you know, Mass DEP's regulations about the total organic carbon.
Is that helpful?
Yeah, seems like it would be possible to take a look at that.
Okay.
Mass DEP.
I mean, I don't know how many other towns are looking at their effluent being, you know, brought to Bayberry, Bayberry Golf Course. And of course, that's the secondary one. The first one's going to where it's going to Parker's River Golf first, and then it's going to Bayberry. So, yeah, you know, I don't think there's any towns on the Cape that are this far along, or that have dealt with effluent needing to go to a secondary location. So I'm not quite sure why you want to know that information. I mean, this is the consultants are, and the people that are doing the engineering are coming up with, say, these secondary sites and then testing them. Like Barry said, they're doing a lot of testing, and they're going through a lot of meetings, at least for the last year, about where the additional effluent, especially during the summer, we're talking about that's when the most of it's going to be generated, you know, where it can go. And Bayberry was selected as the place. But again, now I guess we're at the point where some of the testing showed that the treated wastewater will not meet their standards, DEP standards, for total organic carbon removed, since it's in zone 2.
Yeah, I mean, I guess that's my interest right there in seeing, not necessarily a report, but just understanding what DEP's regulations are for that water.
Right. And I don't know the specifics for that. They just said that they had requested a waiver from the Mass DEP's regulation regarding total organic carbon removal.
Yeah, I mean, as you mentioned, carbon's not typically something we look at
Right,
here.
exactly.
So that's my curiosity, is just, you know, what does a report look like for that water? Just
Right.
strictly out of
And-
curiosity.
And that doesn't come to us at RAC, no.
Yeah, that makes
That
sense.
goes to the the engineers and the consultant, the project manager, and then they deal with that. We don't get involved in that level of detail of dealing with the regulatory agencies and all.
Mary,
But,
thank
like
you
I
for.
said, it doesn't come up.
Go ahead, Mary.
I was going to say, it doesn't come up much that there's something that might relate to the Board of Health, so I just wanted to bring that up, that was out there. And the first time I'd heard that it was something that was an issue from the beginning, so.
So Barry, how does this effluent get to Bayberry?
Pump stations,
Right,
pump stations.
the big pipes they're putting in and that
I see.
get it from pump station to pump
Tied into
station.
their irrigation system? then?
Yes, it will be eventually. Yeah.
Right,
So
they'll
they're
be
gonna
for
put in
watering,
holding
yep,
tanks and then,
Yeah, the big, deep pump stations,
okay.
and use it.
My understanding is that the use of reclaimed water for irrigation is pretty common practice elsewhere
Right,
in the
right.
country.
I
So
would think so.
be interesting to
We're gonna have
learn a
the
little
Yes.
more about it.
On the Cape.
Yeah.
What's
that?
We're gonna have the greenest golf
Yeah.
courses on the Cape.
yes.
It may help cut back on fertilizer use then.
Very advanced
Hopefully.
process in Holland.
Mary, thanks again. You're putting a lot of effort and time into this.
Thank you.
I just have one item on new business, and that's just the website, which I periodically bring up, and that we don't, right now, don't have a lot of information about health issues for the public. You know, looking at the first page, I looked at before on the website before I came in tonight, it was wastewater Construction Employment Opportunities Channel 8 Emergency Communications Center. And that's what you see. And I tried to navigate the website and really didn't come up with very much, trying to find updated measles, mosquitoes, which we know a lot more about since our last meeting, bird flu. There's really not a lot on the website.
Have requests, there's stuff on there from a while. The person in the IT department that did the website has retired. They're in the process of looking for somebody, so they're short 2 or 3 people over in the IT department, so they're trying to get it as fast as we can. We're trying to update. I know Sarah's sent a couple requests. I've sent a couple requests, so we have some stuff that we're trying to get on there, definitely.
Because there's, I think, at least one simple thing. I had sent it in to the health department. It was just a list of things about mosquitoes that we learned that she had put together, make it very simple, some of the key things to keep in mind. So it doesn't have to be complicated at all.
Well,
No one wants to read complicated, long things, so it may be the top 5 things on measles. That's all.
I forwarded that email you sent to me. That as soon as I opened it up, I read it. I forwarded it on, and
Yeah.
unfortunately, we saw where it landed. So I'll get with Mark as the director of the special services, see if he can talk to IT to get some more stuff on that.
If I can participate in that, I'd be happy to. We can maybe get something up there. These are kind of really important issues. The next thing would be scheduling a next meeting. If it's in 2 weeks, that would be April 21st.
And we are off that day.
That's Easter Monday?
It's Patriots Day.
Patriots Day.
Yep.
Okay, so where does that place us then for the next meeting?
Would be all the way to May 5th, or if you want to do it sooner, we could do the 28th, or we can go all the way to May 5th. That's your call.
Board members, what would you like to do here? Obviously, emergency comes up, we meet. It doesn't even have to be on a Monday. So, assuming there are no emergencies, what would people like to do?
I'm going to hold off until May 5th. Cinco de Mayo. We can have nachos.
I'm free.
I'll just have to do it by Zoom because I'll be in Braintree with my grandchildren, but I can still make that.
Well, the material will be age appropriate, so don't worry, they can watch.
Yeah, we're a pretty good group.
I'm okay there. So we'll do May 5th? Sure.
Sounds good. We do have a couple items on that agenda already, so we'll be good to go.
Okay.
Any applicants for the director position?
Well, we did have a second one, right? And the gentleman
That
took
was-
another job, yes. And so the previous one.
Yes.
So that's where we are right now. I don't think anyone's being interviewed. I don't think so. If,
Not that I'm aware of. I know it's out there. I know it's on the Mass Municipal Association website. It's on MHOA website. It's
posted.
It's out there, so.
Yeah, it's posted. I know Bruce is looking for someone. Have they found someone? You know?
Do not know.
Yeah.
There's 4 towns that are looking for directors or assistant directors.
Wow.
What are the towns?
Harwich is looking for a senior health agent, Brewster, and then Dennis. And I think there's one more town. I'm not for sure.
Okay.
For something.
Right.
What are the requirements for Board of Health Director versus Assistant Board of Health Director? Is there a big difference?
It would actually be a health department. We're a separate entity, being the board. So yes, it would be director and then assistant director for the health department.
But is there a difference between those two positions as far as qualifications?
Yes, on
Certainly,
the,
you know more about it than I do, sure.
on the, what's it called? The general postings, yeah, there's a little more qualifications, a little more time, effort, some extra certifications that are needed, so.
I see.
Yeah, it's quite a bit of formal education and certificates. And then there's previous jobs, of course.
Sure.
Obviously, where someone's living is important, you know, so that's obviously an issue here on the Cape. You're welcome to apply.
No, you're over my head here, so.
Eric? No, okay. Forget that, okay.
I was thinking of Barry.
Okay.
I'm still looking to get a couple more certifications.
Okay.
I'm actually currently enrolled in classes at Four Seas Community College, taking some science classes so I can get enough. I have a master's degree, and when I went to go apply for the my registered sanitarian, my certified health officer, I was denied. I was really surprised why I was denied. Come to find out, I didn't have enough science credits. My background's in business, so I had math and marketing and stuff like that. So I am currently, this semester, I'm enrolled in 12 hours at Four Seas. Last semester, I just went and I'm enrolling in four credit short-term summer and another 4-term, second term, short-term. So I'll be taking another 8 hours this summer. And hopefully by then I'll be real close to be able to reapply to be able to take my registered sanitarian
Okay.
certification.
Oh, that's exciting. That's great.
Yep, good luck.
Thank you, man.
I think you give the chair here some credit, because we're going to get out in time to watch the finals tonight. Right, Dr. Vinny?
Sounds good.
Yeah?
Great
So-
last night.
Yes, was it great game? You want to see
Connecticut
it? Yeah. Or Saturday night, actually, the last 3 minutes of the Duke game was great. You don't have to put this in the minutes, but anyway. So who are you going with tonight, Larry? It's Florida and
I'm a
it's
Big 12
Houston.
guy, so I have to go with Houston.
Yeah, I do too. They're not supposed to win, but I think they will.
Well, I don't know. This
Speak to you at
good
halftime.
game for both.
Yeah, it'd be great.
Yeah.
All right, so let's move along. Anyone want to make a relevant motion, please?
I move we adjourn.
Second.
Okay, it's at least one there. Okay. All in favor of leaving here tonight, raise your hand, say aye.
Aye.
Case meeting's adjourned. Thank you, everyone.
Thank you.
Good night.
Night, Mary.
Mary.